Gestational diabetes treatment differs from the treatment for most other cases of diabetes type 2 because of the baby. There is no opportunity to use some of the most common diabetic drugs to treat the disease, because of the fear that the baby may also be subjected to them. So, in most gestational diabetes treatment plans, it is almost always a woman's own work that solves the problem. This disease affects up to 10% of all pregnancies in the United States, and because of that, it is an extremely serious problem. A baby who is born to a woman with gestational diabetes may be born too large, which can cause delivery problems, or the woman's health may take a turn for the worse. It is not unusual for a woman with gestational diabetes to continue into type 2 diabetes after the birth. There are some natural approaches to this that can be done by the woman to reduce her blood sugar levels, such as taking natural diuretics. She cannot take prescription diuretics because this could harm the child, but by eating foods that are diuretic in nature, she can reduce the excess water in her body. The other problem is, of course, blood pressure. Instead of taking beta blockers or retinol to reduce blood pressure, the expecting mother will have to reduce her caffeine intake, reduce her sugar intake and limit her carbohydrates. These changes will serve the same purpose as beta blockers or retinol, and unlike when using these drugs, she will actually feel better without side effects. Should a woman's diabetes turn into type 2 diabetes after birth, then beta blockers or retinol may be used to reduce her hypertension, but until then, gestational diabetes treatment usually consists of monitoring blood sugar, changing the diet and exercising lightly. Learn more at ace-inhibitors.info.